Thermotherapy is a therapeutic method that exploits the benefits of extreme temperatures, combining the use of heat and cold. Cryotherapy, which literally means cold therapy, is a treatment method that consists of exposing the body to very low temperature for a short period of time. Whole-body cryotherapy is often done in a dedicated cabin or in ice baths, where one stays 2 or 3 minutes at extremely low temperatures down to minus 140. This practice, once reserved for the medical field, is now widely used in sports for its many benefits on recovery, injury prevention, and performance improvement. First of all, cryotherapy acts on the body through thermal exchange by extracorporeal convection and by intracorporeal convection. When the athlete enters in the cryotherapy cabin, the skin temperature drops rapidly from 34 to 7 degrees, which causes a thermal shock essential to activate the physiological benefits. Exposure to cold will therefore have physiological effects on the body. In addition, cryotherapy has analgesic effects on our body. In fact, the cold slows down the nerve conduction of the fibers, responding for pain. In addition, stimulation of thermal receptor describes the integration of pain by the brain, revealing pain for a long time after the session. In addition, intense cold is also anti-inflammatory by reducing prostaglandin responding for inflammation, which promotes better recovery after an injury or effort. Athletes also benefit from the anti-edematous side thanks to vasoconstriction, which reduces post-traumatic edema by reducing localized inflammation and the improvement of hematology function, which corresponds to a reduction of hemolysis linked to effort. Finally, whole-body cryotherapy stimulates the immune system, which will induce better resistance to infection, and it will also increase antioxidant activity, which will protect cells from the effects of oxidative stress after exercise. Cryotherapy will also have a positive effect on mood thanks to a rise of endorphin in the body.
The concept of local cryotherapy is based on the short-term application of extremely low temperature to a particular area of a patient's body. The affected areas are precisely targeted for 8 to 10 minutes with cool, dry air. Local cryotherapy helps to improve physical performance, relieve long-term pain, reduce inflammation, ensure rapid muscle recovery, improve blood circulation, and minimize scarring. More specifically, here are the chemical phenomena induced by exposure to very low temperature on the human body, particularly in sport. Tissue cooling not only reduces the rate of cellular respiration, but also releases certain enzymes from damaged cell. By reducing the permeability of the endothelium of the blood vessel, the risk of swelling is reduced as the contraction of the vessel reduces bleeding. The speed at which stimuli are transmitted is reduced, and as a result, so is the sensation of pain. Thanks to this, athletes can push back their pain threshold during exercise. In addition, studies of the influence of cold on collagen, a component of tendon, ligaments, and muscles, have shown that cold make fibers more elastic and therefore more resistant to extension. Similarly, the influence of cold on muscle limit muscle spasms and reduce intertissue tension. The application of cold treatment to chronic trauma is identical. A bag filled with ice, weight towel containing ice, the athlete lying on the ice. Certain forms of localized cryotherapy, such as cold air circulation or liquid nitrogen, which is more effective, have become commonplace. A large number of chronic traumas cause damage to the connective tissue, protecting the joint and destruction of the joint surface.
An important point is to use cold as soon as possible after your injury and the onset of pain. The sooner you apply the cold, the better it will act on your injury and your pain. The cold will contain the inflammation that occurs in response to trauma, not block it. In fact, not blocking the inflammatory process is vital, as it is directly linked to the repair of damaged tissue. The cold will therefore limit pain and healing time, allowing for better recovery. What types of injury can I use cold on? Cold will have a positive effect in traumatology. In case of dislocation, tendon and ligament and muscle tears, muscle strain, sprain, stretching, contusion, tendonitis. The aim of the RISE protocol is to promote faster recovery. The 4 phases of this process are here, rest. In simple recovery or after an injury, the rest phase is very important. Don't neglect it. In the event of an injury, it will help you avoid an unfortunate worsening of the injury. Icing. Rapid icing of the bruised area will relieve pain and limit the spread of edema. Muscle fatigue will also be relieved. C. Compression. Compress the injured area to return blood to the earth more quickly. This will limit the spread of edema and speed up recovery and healing. E. Elevate. Elevate the injured area in relation to the earth, particularly if the injury is to the lower limbs, to speed up the return of blood to the earth, reduce swelling and promote healing.
So, we've seen the effect of cryotherapy of the cold, and now we are going to look at the effect of it on the body. Let's start with the role of it in warming up athletes' muscles. Eating the muscles before exercise as a part of a warm-up or controlled thermal application helps to prevent injury thanks to precise physiological mechanisms that optimize muscle and joint function. It causes an increase in the internal temperature of the muscles. This stimulates enzymatic activity in the muscle cell, which improves the efficiency of the biochemical reaction required for muscle contraction. As a result, muscles become more reactive and efficient, helping to reduce early fatigue, and addition faster contraction areas of muscle fibers reduces the risk of spasm or tears. It is also a key element in the healing process, particularly during rehabilitation. It offers a number of significant benefits to recovering patients. Applying it to the affected area can help relieve pain, relax tight muscles, and improve blood circulation. This can make a significant contribution to speeding up recovery. When muscles are tight as a result of injury or surgery, this can lead to discomfort and reduced mobility. Thermotherapy works by relaxing the muscles, allowing the patient to move more freely and actively participate in their rehabilitation. In addition, improved blood circulation means that essential nutrient and oxygen reach damaged tissue more quickly, promoting healing.
Heat can also act on patients' perception of pain by reducing it. This feature plays an important role in recovery exercise for injured athletes. Let's have a look on it. When tissue damage occurs, specialized nerve endings called nociceptors are activated. These nociceptors relay nerve signals through the spinal cord to the brain, where the sensation of pain is interpreted. Simultaneously, neurotransmitters initiate a spinal reflex that enhances motor activity and muscle tension at the site of the injury, resulting in an involuntary muscle contraction. If this condition persists, the elevated muscle tension can lead to painful spasm, which may cause further tissue injury due to reduced blood flow and oxygenation in the surrounding area. This intensifies the pain, creating a cycle referred to as the pain spasm pain loop. Thermoreceptors play a role in breaking and mitigating this cycle. These thermoreceptors are specialized nerve endings that detect temperature changes and respond to fluctuation in skin temperature. They generate nerve signals that inhibit nociceptive transmission. By applying it, thermal receptors in the skin are stimulated, sending signals to the brain to diminish the sensation of pain. This reduction in pain helps patients engage more effectively in their rehabilitation exercise. Finally, let's see some concrete techniques used in thermotherapy. Since ancient times, water has been used for therapeutic purposes. Over time, the whirlpool bath has become a widely recognized and used physiotherapeutic treatment. There are also heating patches that can provide natural and local relief from muscle pain. This classic method is simple yet effective in promoting blood circulation and relieving muscular tension. A last example of heat therapy is the infrared lamp. It's an excellent tool for thermotherapy in physiotherapy. Physiotherapists can use infrared lamp during their manipulation sessions. By massaging the tissues, the physiotherapist seeks to create heat on and under the skin in order to relax the muscle. With an infrared lamp, this work is facilitated and accelerated.